Hey there and welcome to Concierge Medicine Radio, your source for actionable advice and real stories of physicians running and growing concierge practices. For more interviews and notes on today's show, please visit conciergemedicineradio.com and enter your email. Now, let's join your host, Taylor Pearson.
I'm joined today by Dr. John Blanchard of Premier Private Physicians based out of Troy, Michigan. Dr. Blanchard is an expert and national leader in the concierge medicine movement and co-founder of the American Academy of Private Physicians back in 2001. So thank you for joining us, Dr. Blanchard.
Oh, thank you for having me. I'm glad to be here.
Well, great. Why don't you tell us a little bit about yourself, how you got into medicine initially, and then what brought you into to concierge?
Sure. When I was 18, I was a freshman at Michigan State University, and my father became sick with a cancer. And at the time, I had no idea what I wanted to do for a career. But I went with my dad to his doctor's appointments and quickly began to see that he was sort of passed through the system, just so people could bill. It seemed as if there was no relationship starting between him and his physician. There was very little care in the health care that he was getting. And it really struck me as something that was odd, because my experience with healthcare prior to that was as a child with a family physician who would sometimes come to our home, and we would go to his office, and it was in an old farmhouse, and he would spend time with us and knew our family and, knew everything about us. And so it was really a stark contrast between what I had remembered as a child and what I was experiencing in 1988 when my dad was going to these doctors. He ultimately passed away from that, and I went back to school and committed myself to becoming a physician that really did provide the care in healthcare. And so I went to, 4 years at graduate at Michigan State University, 4 years of medical school at Wayne State School of Medicine, 3 years of residency in family practice at William Beaumont Hospital. And then in 1999, got out and began practicing as a private physician. As a doctor, a family practice doctor in the traditional healthcare setting. And at that point, it became very clear to me that it wasn't the doctors that were the problem. It was the healthcare system as a whole. The healthcare system was built around a fee-for-service model of healthcare delivery where doctors were paid for the things that they did. And as a result, patients were treated as just sort of vessels through which the healthcare system could bill, and all of the motivations were there to just see more patients. There was no payment based on value. It was more about volume. And that was very disheartening for me, someone who had many years earlier committed myself to becoming a different kind of physician. So I knew that I couldn't practice that way, seeing 20, 25, 30 patients a day and not having a relationship with them, not having the care and health care. And so I committed myself to developing a new model of healthcare delivery and make it a meaningful part of healthcare reform. And that's how we began practicing a concierge style of medicine back in 2001. We never really liked that terminology because it seems elitist, but that's the way that the media coined it, the type of model where doctors work for their patients. But in reality, it's just going back to the way healthcare was practiced for thousands of years, where doctors worked for their patients and the patients paid them for their service.
You got into doing this before a lot of people were even talking about it. Could you go into a little more detail about how exactly that works, how your practice is set up?
Essentially, patients pay $209 a month for an individual, which is $2,500 a year. For a husband and wife, it if we take $500 off a year, so it's $4,500, and then dependent children are $1,000 a year. We have not changed our fees, or what we bill. We have not changed since 2001. You tell me one other service in healthcare that hasn't had significant double-digit inflation over the past, 14 years. Every other service that's been rendered in healthcare, goes up in cost. Ours has stayed the same. Before that one low monthly fee, patients have access to soup to nuts primary care. They can come in as many times as they want, and we manage, diabetes, high blood pressure, high cholesterol. There's no co-pays, no deductibles when they come into the office. We practice much more prevention because we're not linked to the fee-for-service model of reimbursement, so we have a very comprehensive head-to-toe yearly physical examination in which we come up with a wellness plan for the patient, whether that's losing weight or screening for cancer or heart disease. We do counseling to help people stop smoking. We spend a significant amount of time on emotional health. We cannot be physically healthy if we're not emotionally healthy. And a lot of us in the country are struggling with significant depression, anxiety, insomnia, and that's ultimately the root for a lot of habits of disease that people accumulate in terms of unhealthy lifestyle and those sort of things. So we really go all in on trying to help the patient attain optimal health in their lives. And optimal health is the absence of physical discomfort, so the absence of pain, that people feel physically healthy and vibrant. It's biochemical health, so cholesterol and blood sugar and blood pressure and those sort of biometric conditions are in line and at an optimal state. And then it's emotional health. It's the absence of anxiety and depression, that people are living life. We try to help people live life with peace and joy, which is, I think, attaining peace, joy, and happiness in our lives is a great goal for all of us. And so we really see ourselves as a partner in helping people attain that state of optimal health in their lives. And we do that through this model of healthcare delivery called concierge medicine.
The word I had kind of banging around in the back of my head while you were talking was holistic, and I guess to an extent I'm hesitant to use that word because I think people hear holistic and they have the idea of like woo-woo, like this concept of, as you said, emotional, physical, all of this it all integrates. They're not separate systems. They're all very much one system, and you can't treat one without treating the other.
Yeah, I mean, it's essentially going back to, if people remember the TV show Marcus Welby, where the doctor, what it comes down to is what is the most important thing in all of our lives. Our lives are not defined by how powerful we are, how successful we are financially. Happiness in our lives is completely related to the quality of and the health of the relationships in our lives, and it's the relationships in our lives that define the quality of our lives. Unhealthy, poor relationships, we're going to have a problem in our life. If we have good relationships, we're going to have good. It's going to be, our lives will be better. And it's today's healthcare system that is destroying the relationship between patients and physicians, because if we want to arrive at high-quality, cost-effective healthcare, you cannot get there if you do not have a relationship between the patient and the physician. And that relationship starts with time. You've got to have time with the patient, and doctors need that time in order to communicate, because it's any doctor will tell you that arriving at a true diagnosis and a true treatment plan, which is the goal in healthcare, you have to be able to take a good history and talk to the patient and communicate with them. And it's through time and communication that leads to a trusting relationship between the patient and the physician. And you have to go through those three steps: time, communication, and relationship before you can get to optimal health care. And this is what has been completely lost among all of those in power in the bureaucracy that is making decisions about what we should do in healthcare. Their solution is to have a model of healthcare delivery where one physician takes care of 2,500 patients, and that physician supervises 5 nurse practitioners or PAs who each take care of 2,500 patients. And, that's not a patient-centered medical home. That's a madhouse. And error rates are going to rise, quality and service is going to degenerate, and the cost of healthcare nationally is going to skyrocket because the people who are making decisions don't understand that health insurance is not health care. Health care occurs in my exam room. It's not a card that you get in the mail. And people are going to realize this once this Unaffordable Care Act really takes hold.
Obviously, we are very passionate about this model, and with good reason. I think a lot of people see, either people that are already doing it have seen the benefits in terms of their own personal lives and the kind of the changes in the outcomes they've been able to affect in their patients. Talk a little bit about your transition and how you built your practice. I think it's interesting. You're in Troy, Michigan, which is not kind of the metropolis most people would think of where a lot of concierge practices are today. How did you move into concierge, and how did you build your patient base up?
Well, it's a lot easier today to transition to this model than it was back in 2001. When I first started doing this, I was one of a handful of people across the country. And most of us at that time were really trying to fly under the radar. We were afraid of what the powers that be might do to us if they knew that we were, contracting directly with patients, which sounds crazy because that's the way medicine was practiced for thousands of years, but it's against the establishment. And so we were worried what insurance companies and what the government might do. But we quickly realized that if we were going to be successful at this on a national level, we were going to need to band together, and that's why we formed the American Academy of Private Physicians. It is a step that takes a significant amount of thought on the part of the physician. It's not something you can decide to do overnight. You have to have a well thought out plan. This model of healthcare delivery is very much more like a real business than our old medical practices, because you are returning the patient to a place of power in the relationship, which is where it should be, because you're giving the patient the power to control the healthcare dollar. And you are in a very real way working for your patients, and that's subject to free market forces. So you could have a doctor open up down the street who competes with you on price at a lower price point, or competes with you on quality and provides more quality and service. And that's really what's been missing since for the past 60 years in healthcare, is that it's been completely removed out of the free market until we're now at a point where there's absolutely no relationship between supply, demand, quality, and price. It's completely outside of the free market. So when doctors are thinking about doing this, they need to do their homework and talk with doctors who have done this, go to conferences. There are many conferences being held around the country by the American Academy of Private Physicians. There are conferences, I'm going into one in June, being held by it's the National Direct Care Summit, which is a part of the Direct Primary Care Coalition, which is another organization in the country. to learn how to best communicate to patients in your practice about what you're doing. And because it's an educational process of educating your patients about why you think this is in their best interest to go to this model and what they're going to be getting for what they're paying. So when we started, I didn't have an office. I had my traditional office, but I essentially just had my black bag and my car, and I would go to people's homes, and they would join the practice, and I'd go to their homes and take care of them there, and until I had enough patients in it that I opened another office and began providing care there. And now we have a total of 7 doctors in the organization. So it really is all about just providing high-quality, cost-effective health care, one patient at a time, and developing relationships with those patients one patient at a time. And if doctors do that, they can't fail.
What does that look like on kind of a more nuts and bolts level? What do you do to make sure the quality of care is really high? Because as you said, it kind of is a more real business environment in terms of competition. What have you been able to say to patients, or how have you been able to educate patients on the new model? Are you doing like educational seminars?
Well, a doctor needs to start at least a year in advance in doing their research, and then 6 to 9 months before their transition date, we recommend having sort of a line in the sand for patients. So you pick a date in the future and you say, as of this date, if you want to be in my practice, you've got to pay this fee, whatever the fee is that you determine. And 6 to 9 months before that date, you begin an educational process where when patients are coming into the office, you, as the physician, are talking to them about it, and you have to be engaged as the physician. You can't just have someone in your office, do the education and trying to sell people on this model. You have to show that you're engaged and that you believe passionately that this model is good for your patients, it's good for you as the doctor, and it's good for society as a whole. If you don't believe that in your heart, then you won't be successful. Or if doctors are doing this because they just think that they can work less and make more money, they're not going to be successful either. So that has to come across, and the doctor has to be engaged. And as patients are coming in, you don't have the time in your busy office day to spend an hour with each patient to educate them about what you're doing. So you just sort of make the introduction about it and then ask them to spend a little time with someone in your office that they can learn more about the model. And then you have collateral material that outlines exactly what it is that they're going to be getting and what the fee is for, and outlining why you as the doctor are doing this. You have to have a unified message between what you're telling the patient, what someone in your office is telling the patient, and what the collateral material is telling the patient. And it's not about the doctor. A lot of doctors make mistakes of writing letters and going on and on about how terrible their lives are and how much they work and how little money they make and their quality of life. And this isn't about the doctor. We're doing this as primary care physicians because we are in the primary position to watch out for the patient's interests. What we need to do is articulate to our patients that we're doing this for them, that we have, that patients want more access to us, they want better quality, they want better service, and this is an effort to make sure that they get what they want, and that we want to work for our patients, not the government or not some third-party payer. And so you have collateral material that you're handing out to people who are coming in.
When you say collateral material, is that pamphlets or what exactly does that look like?
Pamphlets, brochures. Some doctors have done short videos where they've put it on like a little disc and given to patients.
Do you send emails out or anything like that?
Yeah, so that's for patients who have been coming in. For patients who haven't come in, we need to send emails to them. We need to send direct, mail pieces to them with brochures or a letter indicating what it is that you intend to do, what the plan is, and then you have informational events that one or two a month where you hold it at a local community center or in your office, and you have wine and cheese or soft drinks, and you give a short presentation, a PowerPoint presentation. You invite patients to come and attend that and ask questions. And it's an educational process. Doctors, they have a hard time with the idea of trying to sell something, but this is really more of a educational process of educating patients about why this is good for them. And we usually recommend that people allow patients to start registering during that period of time. So it might be 3 months before the drop dead date, but patients are able to sign a agreement saying that they're going to join as of that date, and then after that date, then you start sending out invoices to the patients for them to pay, and you need to have that all set up and ready to go on the billing side of things. And what we usually find is that I've helped lots of doctors across the country do this, and almost universally, I'll get a phone call in the 30 days before the transition date, and the doctor is freaking out because he only has 70 patients or 100 patients, and he needs 300 to break even. And almost universally, in that last 30 days and the 30 to 60 days after the transition date, he'll double what he had at that point. So if he had 100, he'll get to 200 or 250 because people wait. They want to see if you're really going to do this. And you can't do it without a drop dead date because people will not milk a cow if they're getting the milk for free. And so you've got to have a line in the sand where patients really do know after that time and date, you're going to be doing this.
So what about for physicians that leave their existing practice to go start kind of from the ground up? What would you say to them?
Well, the difficulty there is that, you have to make a living. So it takes time to build a practice like this up. And, it takes word of mouth. And, we've found that traditional forms of advertising, don't really do well with this model.
Why do you think that is?
Well, it's the way it's always been. I mean, for professional services like lawyers and doctors and accountants, the vast majority of their business comes from referrals. So you either, are successful or you fail based on, how well you provide care to people. And that takes time. So I wouldn't, spend a ton of money on a very expensive office and, radio and print and those sort of things. I would take, any free print you can get, like interviews and stuff like that. But I've seen a lot of doctors make a huge mistake where they have this notion that they'll borrow, $250,000 and open a lush office with granite and, all kinds of amenities and, do radio advertising, and then they find out that nobody's coming, So if you build it, they may not come, so you have to have a real well thought out plan for how to make this successful.
And so you think that plan is more about kind of not necessarily one-on-one, but in-depth patient education, that traditional advertising doesn't work because you can't redefine someone's conception of healthcare in a TV spot. There's got to be some more depth to it than that.
Yeah, it really is hard on a short print advertisement or radio piece or TV to really articulate how this model is different than traditional healthcare. You come off sounding like, so many other medical professionals that, say that they do, that they care about patients and that, they you sound like everybody else, but it's not until you truly experience, an hour-long visit with a doctor who's really communicating with you and forming a relationship, rather than the 5 to 10 minutes of care that people normally get in the traditional healthcare setting. That's if they can see their doctor. More and more you can't even get in to see your doctor, let alone talk to them on the phone. Or the first time when it's Saturday at 7 o'clock at night and you've got some abdominal discomfort and you don't know whether you should go to the emergency or not, and you can pick up the phone and call your private physician on their cell and talk to them right then. It's not until you experience that you truly understand. Because we've not had that for so long in healthcare that people don't even know what that looks like. It used to be that the relationship with your physician was as important of a relationship professionally than any other relationship in your life. And that's now all gone, and that's why people are turning to the internet to make their own diagnoses. They're more and more doctors, because they can't make money in the traditional healthcare setting, or turning toward what you call the holistic medicine, where they're selling nutrients and doing all kinds of crazy body scans and laser hair removal and things that offering things to patients that are not proven to be effective in the literature. And patients are increasingly turning to that, because a lot of times these providers are spending more time with them. So they are having a relationship with them, but they're making their money from selling things that aren't in the patient's best interests. A lot of times people don't understand or realize that the term blowing smoke up your ass came from a procedure that was done in the late 1800s, where physicians would burn tobacco and literally blow the tobacco smoke up people's ass, saying that it'll cure everything.
I did not know that.
And that's where we're getting back to, the term snake oil. It comes from the same time period. And, people are, because there's no relationships with doctors who truly are practicing evidence-based medicine, they're turning to these other forms of treatment, and in some cases turning away, even cancer treatment and those sort of things that have been proven to be, in their best interests. It's a really sad state of affairs. The relationship between patients and the physician historically has been among the highest professionally rated, relationships on multiple surveys. Like if you ask patients who they trust the most, their congressman, their president, their lawyer, their accountant, their physician. Physicians traditionally ranked, by far way above all the rest in terms of a professionally trusting relationship. But over the past 15, 20 years, that's been really damaged, and I think is only getting worse.
Well, let me steer you back towards something you mentioned earlier. You kind of alluded to this model, the concierge model, was much more like a real business. So one of the aspects you talked about, kind of this patient education piece, you got to convince them, you've got to very much earn their business. They have to decide, every year to pay you again for the service you're providing. Are there any other elements you would say physicians should be prepared for that maybe they're not used to dealing with?
Well, as the primary care physician, in this type of a model, you really do become the first point of contact for patients for whatever medical problems that they have. And they really do look to you to help them direct in the right directions. It gives us the ability as primary care physicians to manage much more than we might have in a traditional healthcare setting, where we'd only have 5 or 10 minutes with a patient. And so, for example, I enjoy taking care of diabetics. So I have people on insulin pumps, and, I don't ever refer someone to an endocrinologist for diabetes, because I take care of it myself. So it allows you as a primary care physician to really deepen and expand the scope of your practice into areas that you have interest in or are competent and capable of taking care of. But to be a good primary care physician, you have to know what you know, but also know what you don't know. And that's one of the pitfalls of this model, is that you develop such a close relationship with these patients that they oftentimes don't want to go see a specialist. They want you to take care of their problem. And so I'm finding myself telling people, listen, I need you to see a cardiologist. I can't do a cardiac catheterization, and this is a good doctor. He'll take care of you. And so sometimes patients want you to, continue to take care of them beyond what your scope of abilities are, and you have to be sure that you know what those limitations are. In terms of the care of the patient, we've got to engage our patients in the ownership of their own wellness. And so, again, this model allows us to do that in helping them to lose weight and lead healthier lifestyles, address depression, address anxiety, and those sort of things. And I think one of the most important things is that it's not just the care that we provide when the patient's here in the office. What this model allows us to do is engage the patient when they're not here in the office. So that means, sending them educational material about disease-specific conditions that they have, or new and timely and important medical information that comes out.
And how do you send that to your patients? Do you have like a regular newsletter, or?
Well, we leverage technology to keep track of, knowing when patients are supposed to follow up for things like diabetes and those sort of things. So we have particular systems that alert us that, hey, this person was supposed to come in for their every 3 or 4 month diabetes check, and they didn't do it. So we know when to reach out to them.
Is there a specific system you're using for that?
We've had one of the problems from a technology standpoint that concierge practices and direct medical practices have had is that all of the electronic medical record systems that are out there are completely built around facilitating billing for services. So they help facilitate documentation and billing insurance for services. The electronic medical record systems out there really don't have the capability to improve quality outcomes. So what we've had to do is actually use Salesforce, which is a relationship management software. It's one of the largest cloud-based relationship management softwares in the country. And we customized that to give us the fields that we need to know who our diabetics are, and of those who are diabetic, who's not controlled and who is. We need to do population management and disease management, and this what we've built in Salesforce allows us to do that. But there's no off-the-shelf or electronic medical record system out there that does it. We've had to actually create it ourselves. We need to know when our patients are going and seeing specialists when we don't know that they are, and so we're working with insurance companies to try to get claims data so that we know when patients are accessing healthcare services that they probably shouldn't be accessed, like going to the urgent care or emergency room, when they can come here and get their care taken care of. So, it's all of these types of things that really end up improving the quality of healthcare and lowering healthcare costs, and using technology to do that.
What's the most common mistake you see physicians transitioning into the concierge model make? If you could only give one piece of advice.
Well, probably the biggest thing is that when doctors are transitioning a practice, they almost universally assume that more patients will join their concierge practice than actually do. So if you talk to a doctor, they'll say, well, I think about half of my practice will, agree to pay the fee and stay in the practice. The reality is that if you get 20% to stay with you, you're doing very well. So, that has to be taken into consideration, in your whole business plan when you're doing the conversion. The other big thing that I think doctors do is they make the mistake that thinking that they can't do this without hiring someone. They think that there are consultants out there. There's national outfits like MDVIP or others that, for as much as a third of your revenue, they'll transition your practice and then keep a third of your revenue going forward. And that's a big price to pay for essentially doing what you were trained to do, which is just provide great care to people. And you don't need a consultant or a company to show you how to do that. Doctors are smart. If they take the time to go to some conferences, talk to doctors who have done it, and have a well thought out plan, they can be successful and do it on their own. So those are the big mistakes that people make.
Well, tell us a little bit about what you see as the future of Concierge. How do you think the Affordable Health Care Act is going to affect it? Where do you see concierge care in the next 5, 10, 15, 20 years?
Well, there was a recent study that came out that I can get you the name of the study later, but in the last 3 years, the percentage of primary care physicians who have converted to a direct care model has gone up from 2% to 6%, which is a huge jump. I mean, that's an enormous movement. So we're still a minority of doctors doing this. We're still just a blip on the radar. But I do believe that what's going to happen is this, I call it the Unaffordable Care Act, will go through 2 stages. First, we're going to go through consolidation into accountable care organizations. And, value in healthcare is defined by the equation quality plus service divided by cost. And that formula equals value. So the system, the powers that be in insurance companies and the government, they're going to focus on the cost part of the equation, okay? So they're going to be hammering to lower healthcare costs. And they'll do that at the expense of quality and service. So quality and service is going to significantly deteriorate in the next few years, and that you will see people wanting to buy out of that system. They're going to want to buy into a direct care model of healthcare delivery where they can truly experience value, and they'll pay to access that. The next step will be a single payer system, because no matter how tightly the system tries to hold down healthcare costs, it's done nothing to address the true problem, which is that it's done more to damage the problem, which is degrading the foundation of a good, high-quality, cost-effective healthcare system is primary care. And the system in place does not reimburse for primary care to provide high quality. And their plan is to bring in nurse practitioners and physician assistants to do the job of the physicians. And I don't have anything against those practitioners, but the simple fact is that they have nowhere near the amount of training that physicians do. And what's going to happen is the cost of healthcare is going to skyrocket. It's 18% of gross domestic product now. Gross domestic product's not going to rise as high as it should because the economy is weak, and healthcare expenses are going to continue to rise, and we're going to see it rise to a level of 25% of GDP. When that happens, the government's going to say, boy, this system is way too expensive. People can't afford it. So what we need to do is we need to provide a single payer system. And that's where we're going, is the single payer system. And that's, I don't know if you've heard of what's going on at the VA right now, where, veterans are, dying, waiting for care on waiting lists. And the administrators in the VA are hiding that there's a waiting list. Why are they hiding there's a waiting list? Because they get bonuses if there's no waiting list. And that's the kind of thing that happens in bureaucracies. Incompetency hides in there. Not only hides, but it's promoted within the system. And so we're going to see that progression occur in direct practice. Physicians working for their patients is going to become a larger and larger component of healthcare delivery. And in fact, it's going to be even accelerated because what we have with these new healthcare insurance policies that are coming out under the Unaffordable Care Act is that the deductibles are $5,000. And this is an important concept because people don't realize this, but 80% of the people in our country consume less than $5,000 in health care in the course of a year. I'll say that again. 80% of people in our country consume less than $5,000 worth of healthcare services in the course of a year. And now their deductibles are $5,000. So what does that mean? That means that we essentially now have a retail healthcare marketplace for 80% of healthcare, 80% of the people in our country, right? They're paying cash for their healthcare.
Right. So you think as soon as all these people kind of see what the system looks like and run the numbers, they're going to realize it's more affordable and they get higher quality care to just go directly to the doctor, a direct pay concierge, than it is to go through the bureaucratic system that the government's setting up. In 10 years from now, where do you think the concierge medicine will be? You said it's gone from 2% to 6%. How fast do you see that growing?
Well, I see it really accelerating over the next 10 years. I think we'll have a single payer system within 10 years. The only option out of this, the only logical option, is that the system recognizes that direct practice is the true answer and that we need to invest in it to actually lower healthcare costs and improve quality, that every man, woman, and child in the country should have access to a physician that practices this way, that can manage their overall healthcare costs, and be one person of 500 that a doctor takes care of instead of thousands that a doctor tries to take care of. Because we have the data to show that applying this model lowers healthcare costs. Our patients in our practice end up in the hospital 1/5 of the amount that a traditional doctor's office does, and those numbers, we're seeing in other practices around the country as well. So if employers got engaged and they began to recognize that they could, for their employees, buy them access to direct practices, we could lower the healthcare cost for employers and lower healthcare costs for the entire system, while at the same time improving quality and service. That, I think, is what we're trying to achieve across the country, those doctors that are trying to do this. Do I think that's going to happen? I really have my doubts, because it so goes against the establishment that I doubt we're going to see large-scale adoption of that type of a model. And the amount of money and lobbyists and interests that are involved in moving towards a single-payer system is just overwhelming. And like most things, the truth gets hidden and gets thrown out when special interests get involved. And so I believe that this type of practice can be a meaningful part of true healthcare reform in our country. Do I think that will actually happen? I doubt it. But I also believe that some form of direct care will survive in this country for those who can afford it. It's just sad that the system as a whole doesn't engage itself in making sure that this is a model that is accessible to the masses. But I just don't see, when it comes to logic and truth, you don't usually see that come out within bureaucracies. just look at our Congress and our president today. I mean, show me where logic and truth is.
Dr. Blanchard, that's all I had to ask you. Thank you very much for your time. I had a good time talking with you.
Yeah, anytime, and I appreciate you getting the word out, getting the truth out, because people need to hear it.
Hey guys, this is your host, Taylor Pearson. To give you a little background on the show, after seeing my dad and sister, both physicians, struggle to find a good resource for how to transition from their traditional practices, I launched Concierge Medicine Radio to create a resource to help physicians and healthcare professionals launch, run, and grow patient-centered direct pay or concierge practices. If you enjoy the show and want to help us spread the word to other physicians and healthcare professionals, it really helps us out if you'll leave a review on iTunes. I know the iTunes interface is a little clunky to say the least, so we put together a quick guide on how you can leave us a review at conciergemedicineradio.com/review, or you can go to conciergemedicineradio.com and click Spread the Word.
Thanks for joining us today at Concierge Medicine Radio. If you found today's show valuable, we'd love it if you spread the word by leaving us a review on iTunes or sharing it with your friends. To see notes on today's show, please visit us at conciergemedicineradio.com. While you're there, leave us your email to hear about all upcoming episodes.